representing Russian Hand Surgery Society, and we have an ambassadorship program. Next year, 2020, we're welcoming a Hong Kong representative in Samara, Russia. As well, we are welcoming all other guests who can reach our destination. My paper today will be not just a true scientific paper presentation, I'm sorry, it will be rather a TED talk about the wrist pain. Does any one of you have a patient in whom you cannot define the precise anatomical unit that is responsible for the pain in the wrist? Well, I had them in the dorsal apartment of the wrist, and I will like to show you a nice approach that I've learned a year ago from my Italian friend Mattia Carozzo in Milano. So, what am I talking about? From the last week, we have learned a lot about the wrist biomechanics from Mark Garcia Elias, and what we've learned that wrist instability, it's not just a one-torn ligament. As well, we know that ligaments are not just the cables connecting the bones to each other. I would like to point out on this procedure, this is a true proprioceptive surgery, because restoring the DCSS, the dorsal capsulouscuffulonate septum, is not a mechanical procedure to bring the bones together, but this is the procedure to restore a neuromuscular control of the wrist. And by this procedure, as described by Christophe Matulin, we can ease the wrist pain. And for sure, I cannot pass by the studies of Elizabeth Haggard, who described the neurological components of the ligaments brilliantly with this Ruffinius, Pacinius, Goldis, and even the free nerve endings. And this is rich innervation of the dorsal wrist. This is how it works. Yeah, the ligaments got tension, puts the signal to the neural system, spinal cord, and then reacts with the muscle that stabilizes the wrist. This we learned from yesterday, for sure. Our idea is that too much impulses, because of the overuse of the hand, can cause not even the control, but pain. For me, it's like too much noise will cause you a headache. So if we overstress the wrist, it may become painful. And there will be no ligament tear, no enlargement of the space between the bones, but it will be pain. And then fatigue muscles cannot stabilize it and will cause more pain. We're trying to restabilize the wrist with the transcutaneous electromagnetic stimulation, and I will show how it works. This is the case from my friend. I'll start the video to show you the MRI. It's nothing very special, but in the dorsal aspect of the wrist, you can see some swelling, maybe an occult wrist ganglion. Well, just a small thing that is not related to a traumatic event. You see there? Well, and we're not just running with the scope or with the knife to excise it. We're trying to treat it in a little bit different way. This is the physical examination of the patient. We check the range of motion, we check the Watson test, we check the tender points, and yes, it's tender on the dorsal side. And most painful in this patient particularly is the wrist flexion. So, no traumatic event, but what to do with them? And we try to use our proprioceptive approach. You see the electrodes, this is a TENS, which is applied to the flexor carpi radialis to make it work, to artificially activate this muscle and see what's happening when we activate. You see the string? Yeah, it's quite easy. You place it on the muscle, and it's like tuning the guitar. You can feel the string that you are looking at. This is the flexor carpi radialis, and you will see the face. Look at the face of this birdman when we try to flex his painful wrist. Well, he has no pain. And then we're going to try work from the other side. And we're trying to destabilize the wrist with the extensor carpi ulnaris, and it causes much more pain than it was before. Yeah, you see the work of the extensor carpi ulnaris. And for me, it's like a tool to test how the extrinsic stabilizers work, and we might use it in the therapy to give the precise exercises to learn the people how to behave with their wrist pain. You see, the ECU destabilizes this wrist. I would like to tell you about my case. It was a piano player who appeared to me with a occult small wrist ganglion, and we thought that this ganglion caused the pain. So I went with an arthroscopic debridement. I did a nice job and got the gel. I sent the extensor tendons. I was happy with my surgery. But in 4 months, he was still painful. We checked on MRI. No cyst, no recurrence. I tested him with the TENS, and we found the APL to be the savior of this wrist. And he started to improve when he achieved the special courses for piano players. And you know what? His teacher told me to abduct the thumb. And we came to the same solution. Me with my experiments and knowing the biomechanics, and this teacher by her experience. At the end, I want to try to solve a puzzle. This is the 9 points, and the task is to connect them with the 4 straight lines without detaching the pen out. Well, I'm running out of time, and I will show you the solution. It will help me to give the conclusion of this series. So this is the first, the second, third, and the fourth. So the conclusion is that there is no box in the wrist. Thank you.
Thank you. Any question for this paper? No? Thank you.
Wait.
Oh, more?
No, yeah. Okay. 1, 2, 3. Okay.
Thank you. So